And as COVID trends continue to drop, the CDC is changing its federal mask wearing guidelines.
The new guidelines mean that most Americans may no longer be advised to wear masks in public settings. 9 on your side's Claire Millay joins us in studio after speaking with local experts. And Claire, what are these new metrics, and do doctors think this decision is wise?
Angie, Ken, the CDC says the new metrics are based on hospitalizations and local hospital capacity rather than just on the number of cases. Dr. Ron May is the Vice President of Medical Affairs at Carolina East. He says he hopes this decision is wise, saying we don't know yet if infection rates will continue to fall among the possibility of new variants.
According to the new guidance, counties will be ranked by low, medium, and high categories. Those in the low level will be advised they do not need to wear a mask indoors. Those in the medium category will be advised to talk to their doctor about masking indoors, and those in the high level will be advised that they should wear a mask indoors.
I do believe that the people at the CDC are smart people. They look at data, and I don't think they would do this if they thought it would be harmful. But I do think it's yet to be known how that will turn out.
However, May says he doesn't expect this new guidance to significantly change the way people are masking in public, explaining that many stores and restaurants are already leaving the decision up to their customers.
So I don't know that it's going to make that much of a difference in those kind of settings where people tend to spend time. It might make a difference in places where there tends to be crowding. And that's what we'll have to see.
He says the Omicron variant has been showing less hospitalization, and that as diseases mutate, they commonly become more infectious but less severe. However,
that's typically what happens, but not always what happens. You know, with Omicron, that seems to be what's happening, but that didn't happen with the Delta variant. That became more infectious and wasn't less severe.
May says he also expects that if this decision turns out to be the wrong one, the CDC will reinstate stricter masking guidelines.
May says masks will still be required in medical settings like hospitals. He adds while he is cautious, he knows guidances must change. He's just hoping that this is the right time for this change. In studio, Claire Millay, 9 on your side.
Claire, thank you.